Our story started in 1916 as a 14-bed provincial hospital of Leyte. Several laws and name changes later, we became Eastern Visayas Regional Medical Center in 1986 with 275 authorized beds.
I am Dr. Salvador B. Ibardoni, the Medical Center Chief 2 of the Eastern Visayas Medical Center. I first became a part of the hospital as a medical clerk and postgraduate intern from 1991 to 1993. At that time, services were already departmentalized with only 2 accredited residency training programs, the Department of Internal Medicine and Pediatrics.
It has always been our fervent wish to produce board-certified specialists. Being the end referral teaching training hospital, slowly we gravitated to increase the number of residency training programs to 8.
In 2013, Eastern Visayas was badly damaged when Super Typhoon Yolanda struck. As an adaptation, the Department of Health relocated the hospital to a new site with its newly constructed buildings complemented with state-of-the-art equipment.
I came back to Evmc in 2018, this time as a medical center chief. The modern physical facilities inspired me to enhance transformation not just in our systems and processes, but also in employees' culture. We revisited our vision, mission, and core values. We embarked on improving the quality of our management systems through ISO 9001:2015 and advanced towards good governance through the performance governance system.
In 2021, Evmc was conferred with a Gold Trailblazer Award for the compliance stage.
Today, Evmc positioned itself to be a fully functional 1,500 authorized bed capacity Apex Medical Center, providing multi-specialty services by 2028, aligned with our DOH and organizational mandate.
With PGS as our beacon, we achieved several breakthroughs.
Our first major breakthrough is the enactment of RA 11567, which increased our authorized bed capacity from 500 to 1,500, and renaming Evmc to Evmc.
We likewise have breakthroughs in patient care.
In 2021, we inaugurated this cath lab. Through this, we were able to perform a lot of percutaneous procedures. Recently, a colleague of mine, an interventional pediatrician, performed septostomy. Since 2021, we were able to perform around 500 procedures. We noticed a reduction in mortality, especially for patients with coronary artery disease, from around 7% to 3%.
Sa totoo lang, ma'am, napilitan ako magpakonsulta dahil yung nararamdaman ko, yung paghihinga at saka yung paglakad. Mahapon na, pasikip ng pasikip yung dibdib ko. Kaya nang tingnan ako ni Dr. Carlo, binigyan ako ng 1 linggong gamot. Pag hindi daw ako nadala sa 1 linggong gamot, susuriin ako sa cath lab. Tinignan yung bara ng heart ko. Kinabukasan, discharge naman ako kagad. Pagka 20 days, back to normal na naman trabaho ko.
Last January, I suffered cardiac attack. The cardiologist referred me to Dr. Carlo Del Pilar and immediately scheduled my angiogram. It revealed that I have arteries that are barred and that we need to undergo angioplasty. And after I was discharged, I immediately returned to work. It seems magaan na. I am more fit to work than before.
Our neonatal center offers specialized medical treatment for our extremely preterm babies, sick neonates with congenital heart disease, multiple congenital anomalies, and infection. With the help of our top management, we were able to upgrade our NICU from level 1 to level 2 equipped with highly specialized facilities and advanced medical treatment. As a result, our sepsis rate decreased from 29% to 8.78%. Our mortality rate decreased from 5.3% to 3.45%.
Nag-anak ako, premature baby. Pag-labor ko, tapos kamadak-an ni Borawan District Hospital. Tapos, igin-refer ako nira nga ito Evmc kay kulangan nira gamit na pwede mano ang premature baby. Kay di rin ako talaga kaya. Giwawas ko talaga 1-5. 30 weeks na po. Ingkatuyahan ko mga 3 weeks. Tapos, after tiging katulad kami kay MC Ward. Haamon sobra sa kabulan dito. Waray ko talaga kami ginbayaran bisang piso. After 8 years, natagan kami ng baby. Yung kita ayan na 6 months. buyag na, malangya.
The Geriatric Medicine Health Facility offers a specialized healthcare services for our elderly in the region. At the heart of what we do is the comprehensive geriatric assessment. We also offer the bone densitometry testing. It is the only one in the region and we are proud of this feat. With outside referral in the previous years, we have brought it down to practically zero at the current.
The Department of Rehabilitation Medicine has Memorandum of Agreement with Latter-day Saints Charities for the provision of wheelchair services. We also have a MOA with Resources for the Blind for low vision rehabilitation services, the first in a government institution in the country. This, together with our prosthetics and orthotic services, has brought down our out referrals to almost zero. Field testing outside NCR for the outpatient benefits package for physical medicine and rehab services by PhilHealth was also conducted recently.
We were also able to perform milestone procedures that were forced in the region.
We strengthen our residency and fellowship training programs to produce more medical specialists and subspecialists for the region and to capacitate the healthcare provider network to decrease referral of primary cases.
From the 8 accredited residency training programs, we now have 12 with the addition of Department of Emergency Medicine, Otorhinolaryngology, Head and Neck Surgery, Psychiatry, and Orthopedic. We are one of the pilot hospitals with a practice-based residency training program. We also offer fellowship training programs in supportive hospice and palliative medicine and geriatric medicine. We are a CPD provider institution. We increase the number of continuing education activities and trainings as part of training banquet.
We strengthen our researches from clinical and level up from descriptive to analytical researches and expand to non-clinical to include collaborative and process improvement studies to enhance hospital operations and policy decision-making. We also conduct consultant-led community-based researches to address the gaps on service delivery at the community level.
Since 2020, we were able to come up with 72 clinical studies that were presented locally, nationally, and internationally. And some of these clinical studies were even published. We were also able to present the interesting case papers of our residents. We were able to win some of these presentations during the contest. We initiated quality improvement projects. At present, we were able to have 13 in-house projects that were translated into policies.
For human resource, at present we were given additional plantilla positions for 800 bed capacity. We have also started the digitization of our HR processes in preparation for Prime HRM Level 3 accreditation.
Hand in hand with these recent developments towards digitization is the improvement of the digital infrastructure of the hospital. We have seamless Wi-Fi for easy access to information and communication and a new server to house the specialty registries and other softwares.
From 500, we have now 629 authorized beds as of March 2023. This is due to the partial turnover of the 3 floors of the support building. To complete the 800 beds by the end of 2024, we expect completion and turnover of the support building, the veterans ward, and the psychiatry building as reflected in our hospital development plan. For our linkages with the community, we have the Evmc extension facility in Revalida. Our clinical department also have adapted communities. We also have 8 memorandum of agreements with provinces and cities as regional apex hospital. For a sustainable hospital operation in the context of increasing number of patients and to comply the no balance billing policy of the Department of Health, we initiated our own financial strategies.
Evmc is a Z-benefit package provider for 8 programs and received PhilHealth reimbursement of 44.4 million for this. The costing for our new services is already done to increase our hospital revenue. We have accredited OFW clinic and psychometric services on an outpatient basis. And we reopened our paid patient services as additional financial strategies.
Through all of these, the functionality of our specialty centers has improved since we started in 2019.
All of these achievements are attributed to our PG's core team, who are mostly the heads of the strategic units which take pride on co-ownership and commitment to implement the strategies. They also assist the OSM in the cascading, monitoring, evaluating, and reporting of the strategy to the different units and staff. At the helm of implementation of the performance governance system is the Office for Strategy Management, who is responsible in managing, overseeing, and monitoring the strategy.
The Office for Strategy Management is directly under the Medical Center Chief. It has 4 committees composed of plantilla position personnel. We refresh our strategy annually and our strategic commitments semi-annually. We ensure that the strategy is cascaded from top to bottom, mainly using the SPMS through the OPCR down to the IPCR. We also have other cascading tools, including our innovation, the Evmc publication magazine, Darangpan. Operations reviews are done monthly and strategy reviews quarterly. Process coaching are also done as needed.
To be more efficient in the monitoring and reporting, the OSM developed an online tracking system for the performance of each unit. Each unit can go to this software and input their monthly operations review, the strategy review. This software is also used, and with this spreadsheet, tables can easily be done, and it will be more efficient for the OSM to report it to the management. To verify the inputs of those operations review, spot audit are regularly done.
The OSM recognizes performing strategic units and are given the PGS Warrior and Best Practice Awards through the Praise Committee. Individuals who have done exemplary work are also given awards at their respective strategic units.
Acknowledging the need for external partners to champion the strategy, the Multi-Sector Governance Council was created and expanded.
The Evmc MSGC is composed of the following organizations and their representatives. The hospital enters into a memorandum of agreement with each partner. The MSGC regularly meets every quarter. Each partner links to a specific need of the Evmc and have committed its expertise for the hospital's cause.
The Multi-Sectoral Governance Council has been an effective tool towards building stronger community partnerships across various sectors. When we have this microcosm of the support system that Evmc needs in order to grow and develop into that world-class hospital that we want it to become, the MSGC plays a very important role. In this PGS journey, the Evmc, we are able to support the work of Evmc. First, particularly through legislation, we have also consistently extended support through our infrastructure requirements. And lastly, in making representation towards ensuring that the proper equipment, manpower support, and the policy recommendations necessary for the realization of our specialty centers. One important intervention that we did is being able to upscale our medical assistance program for indigents. We were able to conceptualize Project Tambal. For every patient who is discharged from admission, he is able to have a complete set of medication.
We in the Civil Service Commission is a partner of Eastern Visayas Medical Center and the entire bureaucracy in human resource and organization development. Tangible of this partnership, of this contribution, is the conferment of the Bronze Award to Eastern Visayas Medical Center in Prime HRM. Likewise, we were active in the development of the Values Restoration Program.
As a partner of MSGC in terms of providing technical assistance in research activities in the hospital, we were able to conduct 2 basic research methods trainings for the hospital residents, and the other one was we provide faculty who can serve as judges during the research contest.
With the universal healthcare, there are 3 critical functions or mandate of Evmc. One is to provide clinical care. The second is the capacity building and research. But the third, which is the stewardship, is very important in public health. My expertise is in public health. Not just because I'm a consultant to Department of Health and PhilHealth, but also we have implemented universal healthcare in the municipality of Tolosa Leyte as the chief executive, which also facilitated the 8-point action agenda of this administration. Awat buhay, mahalaga.
Aside from being compliant to the ease of doing business law, we also institutionalized the Value Restoration Program Committee to improve governance culture.
The committee is currently conducting SPINE, Module 1, the I, and integrity. The values identified in integrity that need intervention are accountability, discipline and order, and taming the tongue.
Evmc has other initiatives and committees that foster a culture of good governance that include continuous quality improvement, integrity management and the anti-red tape, wellness programs for hospital employees, and compliance to the Green Viability Assessment.
Our leadership team is supportive and committed in the implementation of the strategy and the performance governance system.
Amid the chaos of the pandemic, the hospital administration and leadership emerged as critical pillars in this battle. The executive committee has been very supportive of all our PGS activities and in the accomplishment of the different strategic deliverables of the different department, units, and specialty center.
To the leadership of this hospital, my sincere appreciation and thanks for their unwavering support for all the endeavors that we do here in the Cath Lab.
Our best practices, small wins, breakthroughs, and all major activities in the hospital are being shared, not just internally but externally to the entire region. We have also been benchmarked by other institutions such as the DOH, the Treatment and Rehabilitation Center in Dulag, Leyte, the Divine Word Hospital, and others. We are also about to launch our weekly multimedia program as avenue for more best practice sharing.
Say District Hospital sent us for training because there's no endoscopy service in Samar. And on April 28, 2022, we conducted the first ever procedure of endoscopy in the island of Samar. Today, Masay District Hospital has already performed 68 procedures. We thank Sir Alfon Daga and the Eastern Visayas Medical Center for training us effectively.
We get excellent rating in our client experience survey. In fact, Evmc has received several recognition and awards from both government organizations and non-government organizations.
Despite all of this, the best recognition that we are proud of will always be the ones we receive from our patients.
Ako po nagpapasalamat sa membro ng CAT Club at saka yung Eastern Visayas. Dahil kahit papano nalibre rin kahit wala akong pira.
Thank you to the management of Evmc, Department of Cardiology, Dr. Carlo Del Pilar, the nurses, and the attendants, as well as the laborers. They are so kind, patient, and their services are worth commending.
Damo nga salamat ta Evmc na maupay nira serbisyohan haamon na bisa namong baby.
Damo salamat sa Evmc. Marayarawa ng bibigyan.
Ako po si Judith Quena, nagpapasalamat sa Evmc at Tingog Party List para sa Project Tamban. Malaking tulong para sa gamot ng aking anak na isang 2 years old na na-diagnose ng cancer noong 2021. Maraming salamat po at malaking turn po ito sa amin.
How do we sustain the strategy?
The harmonization of the performance governance system to the strategic performance management system and the quality management system, linking the strategy to budget and incentives, a functional MSGC and OSM, empowered PGS core team, updated and aligned basic governance documents to organizational mandate, and the institutionalization of succession planning assure us to sustain our strategy. As Evmc continues on this transformational journey towards good governance, we look forward to the full implementation of the RA 11567, increasing our bed capacity to 1,500, full functionality of the remaining specialty centers to achieve our breakthroughs and impact to our clients, full digitization of our hospital systems and processes, and the accreditation of our Institutional Ethics Review Board to Level 3 to pave the way for us to conduct clinical trials. All of this are Evmc's contribution on the promise of universal healthcare and to the realization of ambition natin 2040. Damo na salamat.